welcome to this week's edition of the Research Sofa. I'm here today with Dr. Chris Attoe, who's going to tell you a bit about his project that we funded as part of the Closing the Gap Network Plus funds. So over to you, Chris. Tell us a bit about your project.
Yeah, hi everyone, and thanks so much for joining. And yeah, thank you for having me, Emily. It's a real pleasure to be here. So I'm currently head of research and development at an organisation called Maudsley Learning. We are part of South London, the Maudsley NHS Foundation Trust, so a big mental health provider based in South London. And our team specialises in trying to take the amazing expertise and knowledge and experience of mental health care and mental health practice to a wider audience. So we do a lot of work with other parts of the healthcare system beyond mental health, and also thinking beyond healthcare as well. As we know, it's super important for the experiences of people with mental health conditions that they're supported throughout society and people are aware. So our project for the Closing the Gaps Network, which we're super excited about, focuses on one of our courses that we've piloted. So I guess we kind of think of a course as an intervention. It's a course that focuses on how we provide improved care for people with severe mental illness, and in particular their physical health needs, or where their physical and mental health needs interact. So we've run this course quite a few times and we've had really good feedback on it. It's been kind of based on motivational interviewing as a skill set, and it uses simulation training where people are able to practice and interact with simulated patients who are played by actors to be able to develop some core skills. I can say a bit more about the intervention later maybe, but for this particular project, we want to tailor the intervention to primary care staff. So anyone who works in the primary care setting who would be able to work with someone with SMI, severe mental illness. And we hope to evaluate the impact of the course before and after, and then at a follow-up time point to help us answer the main kind of research questions of what the impact of the educational intervention can be on participant-reported attitudes and empathy towards people with severe mental illness. And secondly, to what extent can educational interventions like these improve primary care clinicians' communication with individuals with SMI? So those are kind of the focuses of what we want to try and get out of this project.
So can you tell us a little bit more about the intervention and why it's needed at this point in time?
Absolutely. I think the kind of why an intervention like this is needed, and lots of other related interventions, is such a compelling and historic now and an important case around the needs of people with severe mental illness. We know that people with severe mental illness are dying earlier, so they have an increased mortality rate, and that can be upwards of 15 or 20 years earlier than compared to the general population. We also know we've known that for a long time now and haven't been able to change it. So obviously we can see that the way that we're providing care, and that includes the way we train professionals, the way we create services, the way we engage with service users and their families and communities and networks, there's something missing in being able to stop that quite compelling and quite kind of sad statistic that we hear about. On a more individual level, and thinking less about the kind of population, we know that for individuals, their physical health and managing their physical health while you have a severe mental illness can be a massive factor on their quality of life and on lots of other their kind of day-to-day experiences. And matched with that, we also know, and all of this is from evidence and research as well as practice, is that clinicians who are supporting people with severe mental illness in mental health services don't always feel skilled or empowered to be able to work on some of their physical health needs. So this kind of creates the perfect storm really in the system that means that people with severe mental illnesses, physical health needs might not be being met as well as they could. And so they're obviously, it's a very complex challenge and needs some very complex solutions and interventions. But one particular area that we're working on is around how we support workforces to improve their skills and be able to improve the care that they provide. So we have a kind of few years of experience in working with a reasonably innovative approach towards mental health education, which uses simulation training and builds on experiences people might be very familiar with around role play or around simulated scenarios in a classroom setting, and also in other aspects of medical education where they do very high fidelity or very realistic simulated scenarios, for example, in something like surgery or anesthesia, where you can have a very well replicated experience of what doing a particular operation is like in terms of the physiology of it for surgeons, for example. We try and recreate that by having trained actors professional actors who are then trained by our service kind of leads and by our clinical educators, as well as by our service users, to be able to portray a realistic, representative, and fair experience of someone with a particular mental health condition. And then we then create a scenario where they're kind of embedded, and a participant or a clinician who's on the training course is able to go in and interact with them in a kind of constructed, safe learning environment that is as closely replicating real life as possible, to be able to allow them to practice their skills. And so it's trying to bring the kind of education and theory more closely to the clinical practice that people are doing day to day through providing that learning environment. And the kind of way that we've been doing that traditionally has been face-to-face. So we have a dedicated sim center for it, and we can also deliver it elsewhere around the country. But at the moment, we've moved all of our simulations to online. So for this particular intervention, we're going to keep with that online method of delivery, and our participants, our primary care professionals who are joining the course, will be joining remotely, and their interactions with our simulated patients will be as a video consultation. So one of the things we found about that is that actually it very much replicates how a lot of people are working at the moment, so translates quite nicely to a training environment.
So that sounds like a really useful and important intervention. And what are your hopes for the future for it?
Yeah, absolutely. So we've delivered, as I said, the intervention in different forms, a few different ways locally, and we know we have some examples where that work has gone on to be built upon by other people who then take our training elsewhere and use their skills with colleagues to kind of help spread the benefit of it. We'd love to see that this kind of training course delivered more, and we're looking at partnerships with places like the Personalised Medicine Institute and areas where we might be able to work more closely with people to improve access to our training course. We've also worked with other people to be able to replicate our courses in their own centres or their own environments, or with their training teams as well. And we're particularly interested in growing the work we're doing with primary care. So locally, we found a real need and a real interest and openness from our primary care colleagues to collaborate on people's mental health needs, and we'd love to make sure that pattern continues as widely as we can.
That sounds really timely and helpful for people and for primary care colleagues to learn how best to deliver these conversations. So really looking forward to hearing about your results and how it goes, and hopefully helping you to spread the word about your intervention to our colleagues in primary care.
Brilliant. Thanks, Emily. That would be really, really helpful. I think I probably should have said what the actual objectives of the intervention are, that they relate very much to our research aims, but we really try and target, in the way that we construct the intervention, people's attitudes. So, one of those experiences where you're interacting with a simulated patient is a really nice way to think about how we can tap into changing people's attitudes towards mental health. Empathy is obviously a key part that comes in there, and that's structured in some of the reflective conversations we have to embed learning after those simulated scenarios. And then the communication skills, particularly borrowing from motivational interviewing, is another thing that is really structured throughout the training course, and something that we hope to see an impact in. So the way we're planning to kind of test that is through a kind of pre, post, and follow-up methodology. So before and after people come on our intervention, we're going to have a video consultation with one of our simulated patients that we'll record. So it starts the learner journey for them, but it also gives us 2 time points to look at before and after that they've actually been on the training. The intervention itself is a day and a half of online training, as I've kind of described. And just before that and just after that, they will also get some validated survey measures, self-report survey measures, to measure their skills around motivational interviewing and their attitudes towards people with mental illness. And then we plan to deliver those validated tools again around a month after people have completed the training and gone back to use it in practice. So through doing some of the video analysis and scoring around the way people communicate and use motivational interviewing, as well as through those structured validated surveys, we hope to come up with a reasonable picture of, if at all, how the course can be having an impact on people's practice.
Just sounds really, really good, Chris. I'm really, really happy to have you on the sofa today and to tell us a bit more about your project. And hopefully we'll be able to welcome you back again and tell us about the results when you have them and how the training's gone and how you've been able to influence things.
Absolutely, really look forward to it. And just thanks again from our team for getting involved with the network, and very happy to pick up with anyone who's interested in learning a bit more or collaborating.
Thanks very much for coming today, and thanks to all our listeners. Bye-bye.
Bye.